Hi friends, this is Sri Vidya. Welcome to my channel on Cardiac Essentials. Today we'll be talking about, they say like isolated pressure. What is this isolated pressure or what do they mean by isolated systolic hypertension or isolated diastolic pressure? So many a time what happens is, kind of sometimes the pressure might be like 120. I'm talking about the systolic pressure, whereas the diastolic pressure might be around 60. Till 60 it's not of concern, but not of much concern I would say, but anything below 60 is definitely of concern. So they generally say like with the process of aging, these are very common. This or like age-related arterial stiffening that prevents the arteries from springing back between beats to maintain pressure. So, this is not the only factor when it comes to diastole being low. So you might be wondering, we have been talking about this systole and what is this diastole? So what is systole? Systole is the measure of the pressure within the arteries while the heart beats. And when you talk of diastolic blood pressure, this is the measurement during the pause between heartbeats. So throughout the day the blood pressure might be varying. So when the heart beats, blood pulses through the arteries to travel throughout the body, and it is not a steady stream like one might imagine, it's not. And the pulse of the blood flow and the pressure it exerts, that too also changes from moment to moment. It's highest during the heartbeat, that is the systolic pressure, and lowest between the heartbeats, that is the relaxation phase, the diastolic pressure. So when you are talking about the blood pressure, it is one of the most important thing in the life. It keeps the human body moving. Blood pressure that's too high or too low can cause symptoms and can even cause an asymptomatic death. So when we are talking about some patients might ask, doc, which is like most important? Is it like the systolic I should be concerned, or is it the diastolic pressure that's more important? Generally speaking, they go in with the systolic, but if you ask me, I would say both are equally important, whether it is a high blood pressure or whether it is a low blood pressure. So if the readings are too low, that only indicates that there is not enough blood flowing to the brain and other organs. That is, next second you have to think is lack of oxygen. So lack of oxygen can lead to many kinds of things. So you might be wondering what happens during a systolic blood pressure. So when you are talking about systolic blood pressure, it's during the heartbeat, the heart pushes the blood into the arteries. So what is systolic pressure? Just like we were discussing before, it is the measure of the pressure within the arteries while the heart beats. This is called the systole. It is the point at which blood pressure is the highest. So when is the systolic pressure considered normal? When the reading is around 120 millimeters of mercury or below that, while a person is sitting quietly at rest. And systolic pressure below 90 millimeters of mercury is considered low and may require intervention and management from the cardiologist, whoever is your healthcare person, physician. And if one is getting like multiple systolic pressure readings, say above 180 millimeters of mercury, then it is considered very dangerous. That is high pressure and should be going to the ER as soon as possible. Like I said, the normal pressure is 120 mmHg, and then the elevated goes up to 129. And stage 1, if you are talking, it will be touching 139, and stage 2 blood pressure is 180 mmHg. And if it is reaching anything nearing like 190, 200 and above, it is a hypertensive crisis. The person has to be rushed to the ER immediately. So when we are talking about the systolic blood pressure, what happens is the heart muscle, like I said before, pushes out blood. It pushes out the blood with higher pressure. That is when a person is exercising, or when a person is under stress, or at any time when the heart rate is increased, the systolic pressure goes up. In these cases, the increased pressure is normal. However, when the pressure is high while the person is resting, that is not normal, and that is considered as high blood pressure. Since your blood pressure can go up when you are active, it's important to take your blood pressure during periods of resting to get the accurate results of your hypertension. So now you might be wondering, like, high systolic blood pressure is usually caused by the stiffening of the arteries. That makes the heart work harder to push blood through them. So when you are talking within the high systolic pressure range, like I said, hypertension stage 1 is when the BP is around 130 to 139, which can be corrected with simple lifestyle modifications, diet and medication. And when the systolic blood pressure goes beyond, like it's touching 140 or higher, is stage 2 hypertension, it's called, which can drastically increase the risk of stroke. And then it has to be treated with the help of course, lifestyle modifications along with medications. And if the systolic blood pressure is touching 180 and higher, say 200 or 220, that means the person is at hypertensive crisis and he has to be rushed to the ER. Please do not take it lightly. Some people, like one of my friend had like blood pressure going around 170 to 200, and he was like, no Shri, that's okay, you know what, please do not neglect health. Be it your thyroid, be it your diabetes, health is the biggest wealth anyone can possess in life. Money can be earned, everything can be earned. I mean, I'm bringing in a personal stuff into this video, please pardon me. Everything can be earned except parents' love, and parents are big assets, dad and mom, talking about big assets in one's life, and is good health. Like I said before, prevention is better than cure. Even little bit of health ailment should not be neglected. You have to go keep up appointments, see your physician. You yourself will feel a difference when you are healthy and when you are with your ailments. Active brain can only be active once it has all the nutrients. Like a plant, as plants needs sunlight, plants needs manure, plants needs water, so is a human body is also needing all the vitamins, calcium, minerals, multivitamins to function properly, be it magnesium, calcium, sodium, chloride. So everything you have to check on your vitamin D3, B12, keep it in place, So let's get on to our normal blood pressure. So for a normal adult, normal blood pressure is 120 by 80 mmHg, or you can even you are okay with 110 by 70. I'm talking about the systolic blood pressure, and 140, like I said before, is high and indicates stage 2 hypertension. So systolic pressure can also be too low, when the reading is below 90 mmHg. It's called hypotension. So what are the symptoms, you might ask? suddenly feeling lightheadedness, dizziness, fainting. And if it is a low pressure, it also needs to be treated, whether it is systole or diastole. Both are dangerous. So there is no question like which is more important, which is not. So survival is being healthy. Survival is one factor, happiness is other factor. Survival is maintaining your body moderately, attending to yourself. Many times we find that people are workaholic, they are like, okay, you know what, I have to submit these reports by now, by today I have to make this much amount. My work is important, but not at the cost of the body. Money is important, but not at the cost of the body. Peace is very important than anything in this world. So let's come back to systolic hypotension. So whether it is systolic blood pressure or diastole, both have to be attended immediately, and systolic hypertension can occur if the amount of blood in your body falls very low. So low blood pressure can happen. Many might ask, what is the cause of low blood pressure? And one time I asked my primary care physician, I called him and said, the pressure is running low. And then he was like, he's not a ER person, but he's a good person. He said like, rush, ER is one factor. He said, okay, try to take, a general thing. He was not really clear in what he was stating. He just said, take some lime water or something. Lemon water is good with salt. But in a long run, I'm not blaming him. He's a very good person, very good at pain management. So, what do you need to attend when you see a low blood pressure? There can be many factors. One is dehydration. Many times we think, okay, low blood pressure, it is heart. It can also be your brain. It can also be your heart. It can also be thyroid. Hypothyroidism can also lead to that. And if it is anemia, that can also lead to that. B12 is also one factor. And I'm talking about diastole, low blood pressure. And dehydration is one of the major factors. Or sometimes bleeding, it can also cause that. So when there isn't just enough blood to push through the body, that can cause the pressure to go low. So low blood pressure can also happen if the heart muscle is too weak or too weak to push blood normally. So when the muscles become weak, this can also be a process of aging, So, or if the heart muscle is damaged, like cardiomyopathy, and can also be a factor if the arteries suddenly widen too much, vasovagal syncope. So a reflex that causes like a fainting. And low blood pressure happens when you change positions suddenly, it can also cause low pressure. So when someone feels very dizzy and not able to stand up because gravity is pulling blood down towards your feet. So this condition is called orthostatic hypotension. With this, I'm going to end up today's video because of the time constraint. Please stay tuned, and if you like it, please do subscribe. Wishing you all a healthy life. God bless. Thank you.